we're relying on people with symptoms to show up and get tested, by the time we see the spike, we're already too late.
Cases of COVID-19 are increasing in almost all of Quebec's regions. The province's health minister calling it under control but worrisome. This as a new study out of Montreal's McGill University finds a need to increase and prioritize testing for at-risk groups, those who are most likely to come in contact with someone who is infected, in order to get ahead of a potential second wave.
Go to the school, go to the business and set up a little testing site and offer testing to all people who work there, all students who are going to school, all teachers.
The study identifies 5 large groups, like those who work in hospitals and long-term care homes, essential businesses, school staff, and children. Testing all of these groups as a means of surveillance, they say, would be crucial.
If you want to increase uptake of testing, particularly to people who might not have any symptoms, you need to bring the testing to them. It needs to.
But at the same time, it is the employer or the management's responsibility to make sure we are working in a safe environment.
Rukaya Amin works in administration at a seniors residence where the overwhelming majority of Quebec's COVID-19 related deaths occurred. Her employer asks she get tested once a month. She believes it should be even more frequent and done at the residence.
I don't want to have to go on my day off to get tested. I made a choice to work in the health sector. Some of these workers, they don't have a choice.
Montreal's poorest and racially diverse neighborhoods were hardest hit by COVID-19, like Montreal North, which still has one of the highest infection rates in the city.
People in that borough are working in jobs that are very vulnerable. So they're frontline health workers. Maybe some of them are working in factories or areas where people are in close quarters. Many cannot afford to socially distance.
The key here is if someone tests positive and they continue working, you're not really gaining anything. So there needs to be, the social and financial support provided to people to go and isolate for 14 days.
The Quebec government announced a series of reforms, including faster testing to be put in place by September 30th and more than $100 million in funding to regional public health authorities. But will it be enough?
If you are pretty much telling these nurses or these kitchen or whoever works, you're forcing them to come into work because there's a shortage of staff. At the very least, you should give services to help them out.
In Montreal, Alicia Rubertucci, City News.